welcome to my YouTube channel. So in today STK Talks, we are going to talk with Dr. Shagun Batra, MBBS. She is a 2016 batch medical student from Maulana Azad Medical College, New Delhi. So we all know that. So she recently bagged Air 1 in NEET PG and Air 13 in INICET. So first of all, congratulations, madam, on your achievement. And thank you so much for accepting my invitation regarding this interview.
Thank you so much, and
Yeah.
it's my pleasure to be here.
Yeah, thank you, ma'am. And also, before starting this interview, so I want to remember a few of our moments. I think first I see you in GHS 2022 by AAPA James in Hyderabad. So you have participated in clinical Jeopardy. So at that time I have seen you, but at that time we don't know now. So but still I remember the clinical competition, and I think you got third, I think, right? So
Yeah.
I remember and before that also I remember you have participated in many quizzes related to various organizations where I was few part of organizing committee. So I'm so happy. So guys, so let's ask madam about everything, how to ace exams, NEET PG, INICET and NES. Before beginning this session, if you are new to my YouTube channel, please subscribe to my channel. So go through the contents, you will really enjoy it. Let's begin the interview. So first of all, the agenda of this interview is we majorly focus on the ideal way to prepare for post-graduation, whether it may be getting a good rank or getting a good score to secure a seat, and a plan of action for next exam. Since in few years, the INICET and NEET PG going to trash and next exam will be soon. So at the end of this interview, we will have a specialized discussion about what is the effective way to plan a study plan for the next. So starting with the first question, let's go to the interview. So ma'am, how you felt after hearing about your NEET and INICET results? Like you got shocked, or you felt like as expected, okay, I written very well, I expected this rank, or any similar feeling?
So when I saw my NEET result, I actually couldn't believe it at first, because I was shocked that it's my roll number. So I sent it to a couple of friends to recheck whether it's my roll number only. So then some congratulations started coming, but it still took me like 1 to 2 days to actually believe that it's me, that it's my roll number.
Okay, INICET, same?
No, INICET, I was expecting that the paper was good, so I was expecting a good rank. So I was like, one is something that nobody ever expects. So I was expecting a good rank. So in that, I was satisfied. I was happy with my performance. But NEET was a very big surprise for me. Okay.
And coming to the next question, when is your NEET PG exactly started, and what is the trigging factor? Suppose at some point of time we feel okay, it's the time to start the NEET PG preparation, and do you feel it is the correct time you started the PG preparation, or it should be earlier, or definitely not late?
So I started my preparation, targeted preparation in my 6th semester. And there was no triggering factor such our seniors guided us, because at MAMC, seniors and juniors have a good relationship. So we follow whatever they do, because every year, even our seniors get amazing ranks. So they told us to join in 6th semester, and that's when we joined. And I think it was the perfect time to join, because 3rd year is relatively free, and anything earlier would have compromised on the textbook learning as well. And anything later would have been slightly late.
Okay, ma'am. And next question. So, yeah, according to you, what is the correct time a medical student can start their PG preparation?
I think 6th semester is the perfect time to start.
Okay. Do you think starting at 2nd year is a little early, or?
In 2nd year you can start, but the thing is that your PG preparation should not compromise on your textbook learning, because the 2nd year subjects form the foundation of all subjects further, like medicine, surgery, etc. So if you don't form your concepts well, if you don't build your foundation well, it is going to be difficult. So you can start, no doubt, but it should not compromise with your textbook learning.
Okay, what I understood from madam, from 1st year and 2nd year, you should build more textbook knowledge so that it will form a good basics for you. So then 3rd year is the correct time to start the PG preparation. where when we come to final year, your textbook reading and PG preparation can be matched.
Yeah, definitely.
Okay. Then, ma'am, like any specific subject you have given more weightage during your PG preparation?
Yeah, so as I started giving tests, etc., I realized that there were certain subjects which were asked, which had a lot of weightage, and they had a lot of chance of getting of being incorrect. So some subjects were PSM, obs gynae, and surgery. So these subjects have a really high weightage. So PSM is something that keeps updating every year, so you need to keep yourself up to date. And obs gynae, although it seems like it doesn't seem that big, but the number of questions that come in both INICET as well as NEET is huge. And surgery is slightly volatile. Like you will read it and you will think that, okay, you know it, but say 1 month later, you will forget most of it. So surgery is something that needs repeated revisions. So I think these three subjects need to be revised very often.
Okay, ma'am. While writing exams, do you felt okay this weightage was followed or any ups and downs of weightage?
No, in both of these exams, I think obs gynae and PSM had a very large chunk of questions.
Okay. So next, like, how is your first year and second year, and any idea you have about PG preparation during that stage?
Okay, so in my first year, I had absolutely no idea. Like I knew there is some PG entrance, but I had no idea about any coaching institutes or what was the weightage. That was the time when we were freshly into MBBS. We had just given entrances, so nobody really thought about giving entrances again. So in my first year, I just focused on reading my textbooks and I focused on enjoying. So that at that time I really didn't think about it. In my second year, I started getting some idea that there is some exam and you have to prepare for it. So, but then I didn't really start any targeted preparation. I did start solving a few MCQs, but that was just to consolidate my textbook learning it for the purpose of PG preparation. I mainly read my textbooks and I focused on that. I had also joined live classes by GRG sir. At like near my college, so those were really helpful to me as well. But even at that time, I really didn't think that it was for PG preparation. I used it more as a substitute for my college learning.
Okay. Next, like it is a most question, like most of the students want to ask you, like which coaching institute app is best for PG preparation?
See, this is a very controversial question, but I would really like to say, honestly, it doesn't matter where you study from. Like, it doesn't matter that much. It matters how you study, and the student matters more than the institute. Okay, so all the resources are good. It's not like they're perfect. There is no single institute which is perfect. All institutes have some pros and cons, but no matter what you decide, you should stick to it. Like for me, I used a lot of them. Of course, everybody's seen that. But I decided that if I'm going to read this subject from this app or this institute, then I'm just going to read it from there. I'm not going to overlap my resources. I'm not going to clutter my notes. So if I'm reading anatomy from one place, I will do it from there. And similarly for all other subjects. So, but I had decided and mapped that out initially only, that I'm going to do the subject from this place. There should be no confusion in your mind. You can use multiple resources, but you should not be overlapping your resources.
Okay, ma'am. Then is it better to study topics in an integrated manner or subject wise?
Yeah, so I have done both of them. I have tried both of these. So the thing is, for integrated learning, there is a specific time. You can't start that too early, because for integration, you should be at least in final year so that you've read most subjects, and you should not be doing it too late, close to your exam. So you can do it in final year and say first half of your internship. I think it's a very amazing way to learn and remember things. Like I used to study CVS from physiology, then I used to study the pharma CVS drugs, and I used to go to cardiology and medicine. So I think the kind of learning that happens that way is amazing, but that requires a lot of time. So that is not something you should be doing close to the exam. Close to the exam, subject-wise approach is the best.
Okay. Then next question is like, please advise the strategy of preparation. Like it's better to watch more videos. Like there is a common way of preparation among all people. Like say they will watch videos among various platforms, and some will prepare self notes. Some institutes are providing the direct printed notes from their thing. Like what is the weightage? How much percentage video watching helps? How much percentage this notes from the coaching notes as works, and how much percentage question solving works? Like what is a good strategy to balance three so that we can give the best in that aspect?
So firstly, I believe that you should always make your own notes. I know that all institutes are providing their handwritten notes now, and it sorry, it feels like a very easy option that you're getting everything on a platter. But you should make your own notes, because there is a certain memory that exists with your own handwriting. You remember that you have written this and you add certain points by the side. So you should always prefer to make your own notes. And if possible, you should attend live classes over videos. See, I understand that live classes are not available everywhere in the country, and it can be difficult to adjust your schedule according to that. So if you can't, then obviously you can do videos, but I would prefer live classes over videos. And even if you are watching videos, then you should always prefer to make your own notes.
Okay, ma'am. And like, what about this question solving? Like, when should we start exactly solving questions, and how much? Like, let's make it 100%. How much video watching? How much reading? And how much the question solving?
Question. Okay. So for me, I used to solve questions simultaneously. Like if I read a topic, I've supposed it in my notes. I read a topic, then I would solve questions for that topic simultaneously. Some people prefer to do it sometime later so that they can test their memory. For me, I found that you can use whatever approach suits you. For me, I found it better to solve them simultaneously so that I could add whatever points are missing in my notes, or I could say bookmark them. And so that was an effective way. And I also used to bookmark my questions. I used to go back to those bookmarked questions while later. So it was sort of a mix of both the techniques. Then, sorry, how much weightage should be given is that if you are in the initial phases of your preparation, then obviously watching videos is more important because you're making your notes at that time. So at that time, MCQs are not that important. So while you're watching videos, make your own notes. Then comes the phase of revising your notes. While you're revising your notes, then MCQ solving is more important. So in the initial phase, say 70% should go to videos, and later you can do it 50-50. Videos and notes.
Okay, ma'am.
Sorry, MCQs.
Okay. And next, how did daily medical college wards classes played the role in your PG preparation? Like, I want to extend this question a little bit, because, like, honestly, many of our students feel like the classroom lectures are not so effective. We cannot learn more, and most people don't prefer to watch classroom lectures, and they want to prefer app videos. And most of people may or may not like to attend wards. Like, but as you, like, while preparing your PG, do you feel like attending these classes? How, like, definitely it will help, but how far and wards? Like, okay, while revising notes, okay, this is the thing which I learned in those ward clinics or in those classes. Like, what is your opinion on this?
Okay. So one is theory and one is practical. Theory classes, I agree that some theory classes are really boring and it's very difficult to sit through them, and you think that I could just watch the video. But then I think attending classes and listening to them, because PG preparation is very targeted, like it gives you a very limited knowledge. But if you sit in your medical college classes, you'll get to learn so many more things, and you get to learn a different approach to those things. If you're going to, you have to sit there, you have to get your attendance. So if you're going to sit there, you might as well listen to them. And as far as practicals are concerned, I think my ward learning and my internship postings played a very, very big role, because there were certain things that directly, like some clinical scenarios that I've seen in my internship, and they directly came in the exam. And such questions are actually asked because they know that you're MBBS students, you're interns. They ask you things that interns would do. They ask you cannulas, they ask you Foley. So if you've not inserted one, how it's going to be very difficult. like even if you've not studied it and if you've done it real life, if you've seen it, you can easily crack those questions.
Okay, ma'am. So next question, any study partners you have, or you self-studied, and any specific seniors or professors or any platform initiated through your college helped you in your PG preparation journey?
So I was more of a self-study person. I didn't really indulge in group studying, but whenever I got bored or I had slightly less motivation, one thing I did was that I picked up a topic and I just asked any of my friends who was around and I started teaching it to them. I feel like there are 3 levels to learn a thing. One is that you see someone do it. Second is that you do it yourself. And the third is that you teach someone. So when you teach someone something, you get to learn the thing in a much better way. And then my seniors, I think my medicine posting, I had my residents were they were the ones who actually inspired me to take I planned to take up medicine, so they were the ones who instilled that who taught me about the beauty of medicine. So my PGs and SRs of Ward 28 at Loknayak Hospital, they played a huge role in my preparation.
Okay. Next question, like which is best among notes editing and like notes editing or PDFs on iPad with good notes app, or hard copy? Like while writing notes, like I think he is asking while writing notes, it's better to write on hand notes or any, like I think iPads, there are some softwares where you can type it and you can draw it. So which one is better? Like your experience, like have you used software or hard copy?
Yeah, so I've used both because when I started my preparation in the 6th sem, I did not have an iPad. So I have most of my notes are hard copy. But as I got an iPad in my final year, so in my internship, I used the iPad was a very effective source because I had all the apps on it, and I could take screenshots, I could make PDFs, and I could annotate them. So I feel the most important advantage that iPad gives you is that everything is in one place and you don't have to carry bulk with you. So there are some people who actually prefer paper, who like to highlight with the highlighter. So I was one of them. I had that old school thing. So I like hard copy notes even now. But if you're comfortable with iPad, I think it's awesome because you have everything in one place.
Okay. So have you used any review books for any subjects?
So I use review books for I think I used it for dermatology. I used Dr. Saurabh Jindal's book for dermatology. Then for PSM, I used Dr. Vivek Jain sir's book, and for pharma, I used Dr. GRG sir's book.
And next question, if a person, like as you said, first and second year are very crucial period, you need to have good sound textbook knowledge you need to develop. Suppose like most of the people may enjoy much in first and second year, later by coming to third year they may realize the importance of basics, then they want to start their PG preparation, but they are really weak in their first year and second year of subjects. When should they start reading about it? Should they concentrate it on third year itself, or final year, or first they need to study third year and final year, then first year and second year? What is the best way to cope up with this situation?
So in this situation, I think integrated learning would play a very great role. You can't really neglect third year subjects for first and second year subjects. So do your third year subject, and while you're doing your final year subject, for some topics, like suppose if you're reading abdomen and surgery, you can read a bit of it from anatomy notes. If you're reading cardiology and medicine, read it from physiology notes. So you should try to integrate the topics. You can't really neglect both, because third and final year have a very big weightage, and so do first and second year. But right now you need it for your professionals as well as PG.
Okay, ma'am. So, ma'am, the next question. So, what is your view on doing rural service after MBBS and then planning for post graduation, or planning for post graduation directly after MBBS?
See, I think it's a very personal choice. Rural service has its own perks. Firstly, you get a quota as well. You get an advantage as far as seats are concerned. Also, you get to experience the real healthcare system in India. So it gives you a good perspective of how things are in our country, and it gives you experience as well. But then again, it has its disadvantages as well, because the people who live in the city aren't that comfortable going to rural areas. And it can, because since you get a break from your MBBS till your PG, it can hamper your PG preparation as well. So it is a very personal choice that should depend on the circumstances that you are in.
Okay, ma'am. So next question, like two questions. One is how to manage your preparation for PG as a final year student. Do you suggest preparing for PG preparation in final year, because in final year the pressure to pass the final year and the overload of subjects is very high, or like is it manageable? Like what is your advice?
Okay. So I feel in final year, you can manage reading the final year subjects only. Don't try to read anything else in final year. Do those 9 subjects very well. Read your notes as well. Don't. I mean, of course, it's not different. The syllabus is the same. Even if it's PG preparation or if it's your college, it's not very different. So even if you read your notes, you can manage your professional exams as well. So for me, the ideal way is to complete all final year subjects in final year itself. That is what I did. So when I started my internship, I was really confident with all the 9 subjects, especially the 4 core subjects. So I didn't really feel the need to read the notes again in the initial phases of internship. I only read them during my revision phase.
Okay. Uh, okay, then you are suggesting like while reading your final year, you can read the only final year subjects for PG as well.
Yeah, sure. Yeah.
Okay. Then coming to the now internship. You know, internship is very hectic, especially in government medical colleges and Delhi MEMC. I can know how the patient load is very high. So the 1 2 hours which we will get, usually feel okay. Let's have a proper sleep. So, but how we should manage, like any possibility to manage the PG preparation from internship? Tell me in two possible ways. Let's say he is very new to the PG preparation, like till final year, a person is just concentrated on clearing in exams, no thought of PG. Just from internship, parallelly internship, he or she is trying to uh, start his PG prep. This is one condition. Second condition is, okay, they have started PG preparation from third year or final year, but now they want to continue it. Like as you mentioned, in final year they finished final year. Now how they can start in internship? But no, they are prepared third year and final year also. But now in internship, how can they start, or how can they link the internship PG prep and old PG prep?
So I feel the second scenario, where you already made your notes and you've started your preparation, has an edge over the first scenario. In the first scenario, when you have no notes, you're starting from scratch. So I feel you should get a video app, any of the ones that are available in the market, because attending live classes is not possible with internship because you have very varying hours. So get a video app, make your own notes. If you can't make your own notes, which is possible because it's going to be very hectic, you can get printed notes. It's like in internship, you have to make the best of what you have, no matter if you have to make some shortcuts. But get printed notes, read from them. So at least if you have a 1 year long internship, at least by 6 7 months, all of your videos and notes should be completed once, and rest of the time should be for revision. But for the second scenario in which you already have your notes, that is you can do a test and discussion course from DAMS or Bhatia, anywhere. So for you have an edge over the first person. So you revise your notes, you do a TND, because I think TND is a very good thing. Firstly, it tests your knowledge very comprehensively, and you have a live discussion as well. And the notes that you make in TND cover the entire subject in a very concise manner. So take TND, do QBank, and you are obviously way ahead of the first person, but it's not like the first person cannot do it. 1 year is a very long time. You can, and you if you do your notes and stuff in 6 months, you can definitely clear the exam.
Okay, ma'am. And how about the first person? He is entirely new to PG prep. So how about starting it from it?
Yeah, like I said, that get a video app and
Oh yeah, you
make
covered.
if you can.
Yeah. That's
Yeah.
right. Now, as a final year student, you covered as an internship. Also, you covered. Okay. Mm. How you use it to manage your free time in final year and internship after your college related to this PG prep?
Okay. So in my final year, actually, COVID hit. So most of my final year was online. Like only about 2 to 3 months were actually in college. So in the time that I was in college, see, if we had college from like 8 to 4, then I would come home around 5 or 6, and I would sleep for like an hour or so. And then for 5 hours, I tried to study. I used to make a schedule for like the entire week, that in this week I'm going to finish this, and I used to study along with my posting. Like if I had a pediatrics posting, then I used to study that subject only from the textbook as well as notes. So in those 6 weeks, I had planned the entire subject so that when those 6 weeks are over, my subject is over.
Okay, ma'am. And okay. And now the next question is how to manage university exams, which is mostly theory textbook reading and PG preparation, like objective questions.
Okay. So in my final year, I used a lot of PG preparation notes for my theory exams as well. Because even in theory exams, in final year, like we had MCQs also, but even in the theory questions, you just need to know the keywords. Like if you know the keywords and if you know the points that the examiner wants to read, which you already have in your notes, you should know how to build an answer from that. That is a skill. Like if you know 5 words but you need to make an entire page answer, you should know how to elaborate it. You should know how to present it well, how to highlight it, how to make it very, like when the examiner reads it, the examiner
Attractive.
doesn't want to even see what you've written because it looks so pretty. So make it well organized. The theory exams test the clarity of your knowledge. Okay, so even if you know the things, you should know how to present them.
Yes, ma'am. So the next question, like as you said, like reading PG books also gives you an edge on university exams because you will learn the knowledge. You just need to frame it in an organized manner. So
Yeah,
okay.
definitely.
And next, I think I have next question is how about using textbooks? I think you have covered this question also in this. Okay, I just asked how about using textbooks for PG prep? You said you can use any specific subject you suggest using textbook rather than coaching notes. This you can answer, ma'am, because like for PG preparation, most of the people try to read their own self notes or coaching notes. But do you feel any subject okay? Reading this textbook entirely, it's is okay. We can directly cover these things in the PG.
See, reading textbooks is not something that you should be doing it during your internship or in the final phases of your like textbooks are not a substitute for notes and vice versa. Textbooks are to be read during a specific time and notes are to be read during a specific time. Okay, so there are few textbooks which I feel play a very important role. Like Robbins is one of them. Robbins is a very beautiful book, and pictures and lines are directly picked up from there. So when you're in your second year, that is the time to read Robbins. Like you shouldn't be reading it in internship instead of notes. You should be reading Robbins. You should be reading Genome, because there are certain the examiners just pick up paragraphs and tables and diagrams from there. So Robbins and Genong are, I think, two very important books. Apart from that, I think reading textbooks is never a bad idea. I've read all the standard textbooks. I've even read Harrison. Although you don't have to read the textbooks cover to cover, you should just be reading the important parts, and it's not that useful either to read them cover to cover.
Okay, guys, like I understand from what Madam said is like you should read textbooks. You should try to read textbook during your academic years itself. By final year, you
Yeah.
should be well versed with your textbook knowledge. When you are in internship, it's not good choice to read textbooks. You should go with your self notes by watching videos or printed notes. It's according to your feasibility and time of thing. Right, ma'am?
Yeah.
Okay. So with this, we almost covered all things related to PG and INICET. There is one question. After that, we will discuss about like exclusive discussion about NEST, because in few years, don't know, even for us. I am from 2K18 batch. Even for us, they may keep NEST in January. I'm not sure. Or in 2024, they may keep NEST. So we are really tensed about NEST, about the pattern and how to prepare, because like till now you will write your PG examination after internship or after 1 year of internship, but when it comes to NEST, you should write it at end of your final year, which needs you should need definitely a good knowledge at the end of the final year. So to get good knowledge by the end of the final year, you should have a proper plan and proper strategy. So now, as ma'am cleared, uh, got good rank and cleared during her first attempt, which is officially a 0th attempt after internship. Now her advice and her inputs definitely help us to frame a proper strategy and plan of action to combat NEST. So that's why I planned this exclusive discussion with ma'am regarding this NEST. So the main intention of this video is everyone, after watching this interview, everyone can plan their own plan of strategy, own timetable, so that they can achieve the desirable, whether it can be a rank or it can be a seat. So they should achieve what they can. So now let's start the discussion about NEST. Ma'am, I think you will definitely have an idea about NEST. So whether it may be NEST 1 or NEST 2, some are saying NEST 1, NEST 2, NEST 3. Recently, there is a notification that from 2021 batch, there would be going there may be 3 NEST 1, NEST 2, NEST 3, like USML is step 1, step 2, step 3. Previous notifications, they mentioned NEST 1 at the end of the final year, NEST 2 at the end of the internship. Some are saying from 2018 batch they will start 2019. So we are really confused. But one thing we should keep in mind, that we should made a plan of action strategy, that we should be well versed with good knowledge and plan, so that we can write NEST at the end of the final year. So guys, let's think by end of the final year we should be confident that we can at least crack a good seat through the NEST. So for that, ma'am, now you suggest, so let's have a small role play time. Let's say you are a 2K18 batch student. You are going to have NEST in 6 months, or you are a 2K19 or you are a 2K20. Like, if we are in final year, how we will combat NEST? Second year, how we should plan for NEST? So because like I think we should parallelly manage university and theory exams, despite how the level of the NEST exam. So now you please take and you advise us accordingly.
Yeah. So I understand that there is a lot of controversy and nobody is really sure about what's going to happen. So if I was in my final year right now, I would focus on my final year subjects primarily, because even if next happens at the end of final year subjects are going to have a much higher weightage compared to other subjects. And even if it doesn't happen, you are anyway going to benefit with whatever you studied in NEET PG. So NEET or next doesn't matter for now. Focus on final year subjects because they would make you a better clinician as well.
Okay, ma'am. Suppose third year, when we are in third year, we have NEST in after 2 years, let's say. So 19 batch student.
Okay, in third year, then similarly study third year subjects as well as final year subjects. So even if next happens, yeah. So basically in the 6th and 7th semester, focus on third year subjects and final year subjects, like I had said previously, that complete all the notes for third year and final year subjects. So even if next happens, you will be prepared. Even if NEET happens, you will be prepared.
Okay, ma'am. And for second year and first year students, like they are very new, I think they can manage. For them, most probably they will have NEST exam. What is your suggestion to manage parallelly this university and first year? So mostly let's concentrate on 2020 and 2021. Let's say anatomy, physiology, biochemistry. Now they are reading that. So parallelly, how to manage the targeting the PG preparation also. I know, as you previously said, first and second year to relax, but now since next, I think definitely we should suggest first year students also to concentrate on PG prep.
Yeah, so I understand that, yeah, because the pattern is changing, so the approach has to change as well. So first year students can focus on the PG preparation as well. But as I said before, it should not hamper your clinical learning or your learning in the classrooms. Of course, it will give you an edge over others. And since the pattern is changing, you should do it, but don't let it compromise with your textbook learning.
Okay. Okay, guys. So first, give preference to textbook. If you have more time, okay, go through the
Yeah.
objective. Even though I think, as ma'am said, if you have good textbook knowledge, definitely you can manage to score
Yeah, of course,
well.
because if your concepts are right, if your foundation is right, even if you don't know certain things, you can apply, because I think your knowledge will help you know the correct answer, but your concepts will help you eliminate the wrong answer, and that is equally important. You should know what is not the correct answer.
Yes, ma'am. So this is what I used to do during my NEET UG. So now I think we have covered about nest also. So even I myself got some confidence about clearing the nest. So nest, nest an important aspect. Like most of the people ask what subjects you read, what is the plan. At the same time, there are some factors which play a key role in making a person successful and making making the deserved rank. So now concentrate on some more like social and psychological, like I mean mental related elements which played a key role in your PG preparation. So yeah, like are there any moments where you felt low during your PG preparation, or like some stressful moments? How you cope up with it? Like let's say you will have a timetable, you have a set, you will have a specific deadline to finish specific chapters or subjects, but you may not reach it at that time. How you cope up with it? How it affected your preparation strategy or confidence or something like that?
Yeah, so definitely there were moments when I couldn't keep up to my preparation, and I was lagging behind, and I was very disheartened as well. But I think you should not spend, or you should not waste too much time on the milk that has been already spilled. So just if your schedule has been disturbed, start again, start afresh, make a new one. Nobody is able to follow their schedule, to the point. Everybody gets some lag, and I made sure that I kept some buffer days in between, so because I was pretty sure that I will not be able to complete them in time, so I had a few 1 or 2 days as buffer in between so that I could cover whatever was left.
Okay, guys. So now the topper is saying that we cannot complete in like as timetable. So don't get disheartened when you don't get finished in time. So as good suggestion by ma'am, keep buffer days so that you can cope up during those days. So next question, like another thing is grant test. At the end of the thing, we write many grant tests. If we say we may not able to reach the cutoff which we set so that we can get a good rank or score, how you motivated yourself so that you can do better in next exam or can better in final exam? How you motivated yourself?
So I feel the tests that I did badly in, the GTs that went bad, were actually more motivating for me than the ones that I did well in. Because whenever I had a lower score than I had expected, I would feel disheartened for a while. But then after that, I was even more motivated to do better, because I had that thing that I have to do better. I have to better myself. So you should not sit and sulk over a bad result. You should only get motivated by it to work harder.
Okay, ma'am. So then one more interesting question is like, you may have some certain target in your mind, whether it can be a rank or it can be a seat in specific college. So tomorrow is your exam or today morning is your exam. So how is your exact feeling? Definitely we will have anxiety. How you coped up with your anxiety so that you can give best in your examination?
Ideally, I believe that one day before the exam, you should not be doing anything related to the exam. Like, even if it's not possible one day, at least a few hours before the exam, close everything, because you studied whatever you could in the last 5.5 years. So do something else, watch TV or watch Netflix, go for a walk, clear your mind. Don't think about, I know you feel like your life depends on it. And of course it does, but thinking about it is not going to make any difference. It is only going to hamper whatever you've already done. So uh, give yourself some free time, have a good dinner, and have a good night's sleep. Don't go to the exam with like 2-3 hours of sleep. Have at least 7 to 8 hours of sleep, and have a good breakfast. Don't go into the exam empty stomach, and reach early. These things are as important as, because if you are stressed or if you are not feeling well on the exam day, everything that you've prepared for until now goes waste.
Okay, guys. So despite that last few hours, the thing which matters is your long-term preparation. So better have a relaxed mind and body before few hours, if possible, at least before night, so that you can perform and give your best during your exams.
Yeah.
So yeah, now like almost all things related to these exams all over. Now few personal questions, like which almost all students really want to know, like which branch do you intended to choose and why?
So I plan to choose MD medicine. And why is that? There are multiple reasons. Firstly, I think when I've gone to the wards, medicine was one posting that I felt was the one that had the most impact on life and death, because I had seen so many deaths in my medicine wards, and I had seen so many people come back to life in my medicine wards, that I felt that, this is an impactful branch. And it is something very interesting. Like, it feels very logical to me and effortless. Like, I never feel like I'm studying. It's just like I want to learn more. And coming to a diagnosis and reducing something makes me feel like Sherlock Holmes, that, I'm just trying to solve a puzzle. So for me, it always felt like medicine, like it feels like I can't do any other branch. Medicine is the one for me.
Any super specialty you are aiming right now?
For now, I haven't really decided on one. I plan to explore during my residency, and then of course I'll do something, but I will decide that during my residency.
College, ma'am? Which college you are trying?
I plan to go to PGI Chandigarh.
Okay. Okay. Any specific reasons, ma'am, you want?
See, I only had two options in mind, AIMS or PGI. So firstly, this time AIMS has a very, very sad seat matrix of only 2 seats. And plus, I have also heard that because the patient load is in PGI is massive, like it's very hectic, definitely. But the patient load is massive, and I think the patient load is what matters more for clinical learning.
Great, ma'am. And now one more interesting question. Like, did you ever consider going abroad like USMLE or PLAB?
Yeah, so I did during my third year, because a lot of my batchmates had started preparing for the steps back then. So I did read up about it, but then eventually I decided that I wanted to be here. I wanted to be around my family, and I know that the status of healthcare in India is has some issues, and we all know them. But I also believe that you should be the change that you want to see.
Great, ma'am. So next question. What, like till now we have discussed about everything about study. So now any other hobbies or any special talents in you other than studies? When you get free time, what will you allow to do?
Yeah, so whenever I had free time, I like to play badminton a lot. In the lockdown, also I played a lot. I also played basketball in my MBBS years, and I was also part of the debating society and the literary society. So I've done a lot of co-curriculars and extracurriculars during my college. And even while I was preparing, like I always made sure that I gave some time to relaxing and enjoying. So I liked gardening as well. and I watch a lot of Netflix. I know people think that toppers don't waste time. I used to waste a lot of time, but then I think the time that I wasted was the one. And you always, after you waste time, you always feel a little bit of guilt. So that guilt helps. That guilt helps you to study also.
Okay. And like as you know, like I read in Para, and I personally also know that you are very good in quizzes. Like how quiz role played a role in you, like in developing knowledge or anything?
Yeah, so I think quizzes were a very important part of my preparation as well. I never looked at quizzes as competitions. I always looked at them as learning experiences, because when you go for a quiz, it's not about winning or losing, it's about learning. You always gain something from a quiz. And I have attended a lot of quizzes. I've myself organized quizzes as well. So, and the questions that come in quizzes are, they are very twisted, and they make clinical, sometimes they make you think a lot. So it develops that kind of thinking that you need to crack PG MCQs.
Okay. So like one more question about research. Like research in undergraduate is not so common. Have you done any research, or what are your perceptions on undergraduate research?
So no, I haven't done much research, but I really wish to. I plan to do more research in my post graduation, and I definitely will read up more about it.
Okay, great, man. So hello guys. I think I have covered almost all questions and added few questions to make interview more good. So and finally, we are at the end of the interview. So before ending the interview, like there is, we want to have a advice and motivation to students in general, so that you all get motivated and get some good piece of advice. Like final note, I could say from you to all the audience.
Okay, so I would like to say to everyone that toppers are no extraordinary people. They read the same resources as you, and they make the same mistakes as well. But it's the consistency and dedication that sets them apart. That even if you fall, even if you make mistakes, you should learn how to correct them. Everybody makes mistakes, so keep practicing, keep making mistakes, but always correct your mistakes. And that is how one step every day will take you to a much higher place.
Yes, ma'am. Also, for like, as you know, every time will people aim to something, but they may not get it. Like, what is your advice? Like, some will feel low, but sometimes the winning, like getting the seat or getting the rank, maybe 1 year late, but they will definitely get. But they may get disheartened or dismotivated and stop there. Like, what is your advice for them, like to bounce back?
Yeah. See, even if it's 1 year late, 6 months late, it doesn't matter. Life is very long, and you should not compromise with your dreams just because of a matter of 6 months or 1 year. And if you believe that you can do it, and with the correct resources, and it's just an exam. If you prepare well for it, you're going to crack it. So 6 months or 1 year doesn't matter. You should not give up, even if it takes time. You should stay focused on your goals.
Okay, thank you so much, ma'am. So I guess I hope you have enjoyed the interview, and sorry if I have made any mistakes, because I'm new to this doing interviews. At the same time, with excitement or while asking questions, I may have small grammatical mistakes or framing questions. So please bear with it. I will improvise slowly. So, and once again I would like to congratulate madam for her achievement, and also thank madam for giving me time and chance to interview her. So I feel very happy, motivated, and learned so much of this. And I hope all will you learn through this interview. So if you have any questions, you can drop in the comment box. And madam, do you use any official social media handles?
I'm just on Facebook. I'm not on Instagram.
Okay. Then there is, I should advertise a small caution. Like I can see a fake profile on your name in Instagram.
Yeah, I know. Please,
So
please report it.
please
Everyone.
report it, guys. So like I thought while keeping Instagram story, I should tag you, but after seeing only I get, it's a fake profile. So guys, don't
Yeah,
follow it
please
and
report
report it. So, okay, thank you so much, ma'am. So,
Yeah.
have a nice day, everyone. Have a nice day. Thank you so much, ma'am. Bye.
Thank you. Bye.